Do you suffer from heavy periods? What causes heavy periods? What can be done about heavy periods? Let's answer these questions today. Hi, I'm Dr. Eniola. I'm a GP, and today we'll be talking about heavy periods. Your periods may be heavy if they last more than 7 days. They may be heavy if you bleed through to clothes or bedding. Now, I have seen some instances where some women have had to have an extra pair of trousers just to ensure that the blood doesn't stain their clothes. I also know some women that have had to use a towel on their bedding just to ensure that the blood doesn't go through to the sheets or even to the mattress. Periods may be heavy if you're having to use more than one sanitary product. So for example, you're having to use a pad and a tampon, or two pads, or having to wear maybe like an incontinence knickers. Your periods may be heavy if you're finding you're having to change your sanitary product very frequently. So maybe every 1 to 2 hours, or sometimes even 30 minutes. I have actually heard some women say that they've had to sit down on the toilet because it's just easier to allow the blood to flow. And there are some women that don't have the liberty of a personal toilet and have had to use a bucket just to allow that blood to flow. That's quite stressful, isn't it? Your periods may be heavy if you're passing large clots, larger than the size of a 10p coin or larger than 2.5 centimeters. Periods may be heavy if they also affect your daily activities. They may also be heavy if you're feeling faint, you've actually fainted, feeling very tired, feeling short of breath, or very aware of your heartbeat. Heavy menstrual periods, also known as menorrhagia, is when a woman loses a lot of blood during her periods and it interferes with her quality of life. So, what causes heavy menstrual periods? Almost half the time, there's no condition that's causing this. You can find this in girls that have just started their periods and also in women around the time of the perimenopause. So the extremes really. So when at the beginning of menstrual periods and towards the end when the menstrual periods are about to cease in a woman's life. There could also be other conditions that cause heavy menstrual periods. Conditions like pelvic inflammatory disease. This is when there's a pelvic infection that could be caused by something like chlamydia. It can also be caused by fibroids, which are non-cancerous growths in the womb. It could be caused by a condition called endometriosis, which is when tissue similar to the lining of the womb grows outside the womb. It could be caused by a condition called adenomyosis, which is where the lining of the womb grows in the womb muscle. It can be caused by polycystic ovary syndrome, PCOS, which is when the ovaries release more follicles. It can be caused by underactive thyroid, bleeding disorders, or when someone's on a blood thinner, and rarely it can be a sign of womb cancer. So, what can be done about heavy menstrual periods? Please see your doctor or your GP if your heavy periods interfere with your daily life. Don't suffer silently. I have met women who have carried on with heavy menstrual periods feeling like that is what they deserve and it has ruined their quality of life. If also you notice that your periods have changed suddenly, so before they weren't heavy and all of a sudden they've become heavy, please speak to your doctor. What kind of things might your doctor want to do? The GP may decide to examine your abdomen to check for any pain. They might also want to do a vaginal examination to have a look at the neck of the womb to check for any signs of infection as well. They may also decide not to do an examination if they don't suspect that there is an underlying condition that can be causing the heavy menstrual periods. If they do think that there is an underlying condition, they might offer you internal swabs, which help to check for infection. They might offer you a blood test to have a look at iron deficiency anemia to see if you've lost a lot of iron through blood loss. They might also offer you blood tests to have a look at thyroid function. They might also want to offer an ultrasound scan to have a look at any ovarian problems or any womb problems. What treatment might your GP recommend? Your GP might recommend a medication that helps to reduce the amount of bleeding called tranexamic acid. They may also recommend another medication that helps to reduce pain if you have painful periods alongside heavy bleeding called mefenamic acid, or at times they may recommend naproxen. Now these medications I've mentioned are on prescription. Your GP may also want to offer you some hormonal contraception in the form of a hormonal coil, the intrauterine system, or the combined pill, or other hormonal options that might be suitable for you. There are occasions that some women have gone to their GP for treatment for heavy menstrual periods and have been recommended or prescribed 1 or 2 things which haven't worked. They've given up, they've gone back home and they've just carried on with the heavy menstrual periods. I would like to advise you to please go back to your GP if that is the case. Go back and have a look at any other options that you might be able to try, as at times we need to try a few things to find out what actually works for you. Now, if these treatments have not been successful or unsuitable for you, you will likely be referred to a gynecologist who is a specialist to offer you further testing and also other treatment which might be helpful. I hope this video has been helpful today. Please share with someone you think might benefit from the video. Until I see you again, take care and bye.